Good evening, everyone. Thank you very much for taking time out of your busy day to join us this evening for tonight's webinar. My name's Jenny Gibbons and I'm a dairy scientist at AHDB Dairy, and I'm delighted to bring in you tonight's webinar on innovation and hoof health with our presenter, Professor Jon Huxley. Tonight's webinar is being run through the Eurodairy network, which is a network of 14 countries from Ireland to Poland and Sweden to Italy. It aims to put farmers at the centre of practice-based innovation through sharing knowledge and solutions. And you can find out more about Eurodairy tonight on www.eurodairy.eu. So tonight's webinar has actually proved very popular. We have over 200 registrations from dairy farmers, vets, nutritionists, consultants and researchers right across Europe and even further afield to Australia, Brazil, the US and Canada. Tonight we're actually trying something different. Jon and I are delivering the webinar in front of a live audience from the Eurodairy network here in Stratford-upon-Avon in England. So without further delay, I'm delighted to introduce Jon. Jon was born and raised on a dairy farm in North Wales, and he graduated from the Royal Veterinary College, London in 1995. After some time on commercial practice, he joined Bristol Vet School, later moving on to the Nottingham Vet School, where he's currently Professor of Cattle Health and Production. He is a UK and European specialist in cattle health and production medicine, and his interests are predominantly in endemic disease of dairy cattle, particularly lameness and mastitis. So, Jon, I'm going to hand over the controls to you here.
Great, thank you very much, Jenny. Good evening to everybody listening in the office and at home, and good evening to everybody in the room as well. Slightly interesting situation with two audiences this evening, but we'll see how we get on. So what I would like to do for the next half an hour is really just give you a high-level overview of where lameness research has gone over the last 5 to 8 years. It's been a really exciting time in the lameness field over that period of time. Things have moved on a long way, and we've started to challenge a lot of the received wisdom that has been out there for a long time on what is causing some of the underlying diseases that which we all know are so common on farm. And so I'd like to sort of give a sort of very high-level overview of pulling all of that together over sort of 25 minutes-ish. I'm deliberately not going to go into the detail of the science this evening, A, because we just don't have enough time, but secondly because I think what would be nice to do is to really just put it all together from start to finish, and be interested in your comments and your questions afterwards to see what you think. Clearly, if anybody would like details of the science, the underpinning work is 20-30 papers now, and you're welcome to contact me for those papers, and/or we can perhaps cover a little bit of more detail as we get to the questions at the end of the webinar. So first of all, can I thank Eurodairy for the opportunity to speak to you all this evening, whether you're at home or in the office or here in the room. It's a real pleasure, and I'd like to thank AHDB Dairy for organising the event, which is titled Innovations in Hoof Health. But what I'd really like to do is focus on these lesions, the lesions of claw horn disruption. All our work at Nottingham has been based on the lesions of claw horn disruption. I'm not going to be talking about digital dermatitis tonight, not because it's not an important disease. Clearly it's a very important disease in most developed dairy nations, but our work has focused on the other half of lameness, the claw horn lesions. And by claw horn lesions I principally mean 3 conditions: sole ulcer, sole hemorrhage and white line disease. However, I'm going to, right from the outset, I'm going to group the first 2, because as far as I'm concerned, sole ulcer and sole hemorrhage are in fact just severe and milder manifestations of the same underlying condition. I think everything that we can say about this severe manifestation of a sole ulcer underlying principles wise, most of it would be the same for sole hemorrhage as well. So actually, I don't really differentiate the two anymore. I just see them as different severities of disease. And in fact, I'm going to go even further than that, and I'm going to say, to me, this isn't a sole ulcer, this is a cull cow. And I'd like to perhaps at the end of the next 20 minutes try and demonstrate to you why I say that now as we go through. Similarly with white line disease, again I've put a range of manifestations of disease, starting with the more severe end at this end, where we see complete separation of the white line. If in really advanced cases, we'll obviously very often see subsole abscesses as well. So when we trim these out with a knife, you may very well hit that pocket of pus, which is the sort of severe end of disease spectrum. But actually, again, and we've been doing this a lot with a lot of the work we've been doing, if you pick these cows up in the early stages of disease, when they first go mildly lame, what you see is hemorrhage in the white line. So these type lesions, rather than the full separation. So those are the diseases I would like to focus on this evening, and in order to set up the rest of the presentation, I've got sort of 3 slides really covering the background, and really it's the next slide which is particularly key, but actually if you can understand the next 3 slides, a lot of what I'm then going to go on to talk about falls off an understanding of the basic underlying principles that we'll talk through. So if we just review a little bit of hoof anatomy. The hoof capsule itself is composed of 2 principal structures, and they are the wall here and then the sole. Now the wall is formed at the coronary band, so the wall actually grows from up here at the coronary band, and it's growing downhill towards the toe at about 6 millimeters per month. So it takes 12 plus months for wall which is being produced today to actually become weight bearing about 12 to 14 months later. And then we've got the sole, and the sole is growing out from the base of the foot at about the same rate of growth, at 5-6 millimeters per month, and those 2 structures are joined together at the white line. So the white line is actually a biological junction between the wall growing from the coronary band up here and the sole which is growing out from the base of the foot. Now what I'd like to do is show you a cross-section now where we've bandsawed up through a post-mortem specimen, and what we've done is we've taken a claw and we've bandsawed on that plane, and so that is what you would see if you opened up that split claw. So we split this claw in half on that line, and you open it up, and that's the sort of the cross-sectional specimen we just want to spend a couple of minutes on, because this probably is the most key slide for everything that I would like to talk about this evening. So again, we've got the wall here. So the wall, this structure of the highest tensile strength, its job is the key weight-bearing structure within the foot, and it's growing from the coronary band up at the top here, going downhill 5 to 6 millimeters per month. Then we've got the sole on the base of the foot, and the sole is being produced from a very thin layer of germinal cells in this region called the dermis here. So there is a very thin layer, and we're talking about a matter of 1+ millimeters thick. These cells are absolutely key, because these are the cells which are going to produce the sole. And you'll perhaps see in a second why they are so key to us, because that is a truly terrible place to be sat, and I'll demonstrate to you on the next slide why I say that. And then within the hoof capsule itself, we've got this wedge-shaped bone, the distal phalanx. We're going to see a lot of this wedge-shaped bone as we go through, and it's a wedge-shaped bone that sits neatly within the hoof capsule. I want to introduce 2 other structures now at this point. Firstly, this very strong attachment of connective tissue which anchors the distal phalanx to the wall. That is a key structure, because that is what tightly holds the distal phalanx into the hoof capsule, and we'll come back to that as we go through. And secondly, the digital cushion, this pad of fat which lies in this very narrow band underneath the distal phalanx and before the sole. And to give you an idea, we're talking about a region here in totality of about 5 to 7 mils. So it's a really narrow structure. And it is a terrible, terrible place to be, because if you just look at the basic biomechanics of how the leg functions, all of the weight of the animal bears down through the limb. And here's the exact two-size skeletal model to equate to the picture. So all of the weight of the animal is actually bearing down to this wedge-shaped bone, the distal phalanx. And so this very thin layer of cells here is in a terrible, terrible place. Above you, you've got 600, 700, 800 kilograms of cow, and below you, for large parts of the year in many of our systems, you've got concrete. And we've got this fine 5 to 7 mil layer with this very narrow layer of germinal cells, the ones which are responsible for producing the sole. So fundamentally, claw-horn disease is a pressure lesion. That's all, in its most basic form, that's what it is. All we have to do is understand what the animal normally does to mitigate excess pressure in this region, and or what can go wrong in some of our systems that means this system starts to fail. Because as we've already indicated, so now we can appreciate that all of the weight of the animal is bearing straight down through this distal phalanx. So firstly, it highlights the importance of that very strong attachment that anchors the distal phalanx to the hoof capsule. So the wall is actually the area of highest tensile strength. It's the structure responsible for bearing the weight of the animal. And now what we've got to try and do is understand why we might see problems in this very fine layer of germinal epithelia. Because if those germinal epithelial cells, the ones responsible for producing the sole, get squashed, the first thing they do is bleed. That tissue bleeds. And so that's what we'll see manifesting as sole hemorrhage a number of weeks later as the sole grows out. So this area bleeds, the blood that's produced is incorporated into the sole horn as it grows, and we see it a number of weeks later as the horn of the sole grows out. And in its most severe manifestation, we can actually completely crush these very sensitive cells here that are responsible for producing the sole. And if we crush them completely, they stop doing their job, they stop producing the sole, and hence we will see this deficit in the sole growing out, which we call a sole ulcer. And very often we see this small piece of proud tissue protruding through that sole, but that's just a manifestation of the biomechanics and what happens when we have that hole in the integrity of the sole. So fundamentally, all we have to do is understand what the claw normally does to mitigate all of that force which is being transferred through it during standing, and particularly during walking, because of course all the momentum of the animal is generated by the hind legs as their propulsive limbs. Now, this is where very often I start upsetting people when I give this sort of presentation, because up until 5-10 years ago, certainly, we would have spent a long time now talking about overfeeding concentrate, rumen acidosis, laminitis leading to claw-horn disease. Rumen acidosis was underpinned all of our understanding of what was causing these diseases. I've had a go at making that stack up from the research literature. I can't do it. I've had one of my PhD students a few years ago have another go at it, trying to see if he could make that story stack up from the research literature. He couldn't do it, and I've now got another one of our PhD students doing a full literature review on this with a full critical appraisal, and she is reporting, we'll be publishing later in the year, that she cannot make this story stack up. If you go back to the research literature, we actually, with this and the underpinning ideas here, we can absolutely show that rumen acidosis, or high levels of concentrate feeding, and claw-horn lesions are linked. But as any good statistician or epidemiologist will tell you, correlation does not imply causation. So it is entirely possible for two things to be linked, but they're not being causally linked. So one doesn't necessarily lead to the other. And genuinely, I think that's where we are with the literature in this area. absolutely you can make it stack up. There's a correlation between those two things. I'm just now not at all convinced that it's causally linked. I'm going to be honest and say there's people who in various parts of the world who disagree with me, and I would welcome that disagreement. And perhaps I need to sort of spend the next 20 minutes just giving you our idea of where we think we are. But just for entertainment value only, and to demonstrate why you can't be sure that two things which are highly correlated are causally linked. Here we've got the per capita cheese consumption of citizens of the United States correlated with the number of people who died by becoming tangled in their bed sheets. Those two things are very highly correlated. They are, no matter what statistical test you threw at it, that would be very highly significant correlation, but I think we can all accept it's unlikely those two things are causally linked, just as an illustration. So of course, that now comes down to me to really really demonstrate and talk you through alternatives to that idea. And what I would like to do is just talk you through what I see as the three principal areas which are causing excess pressure on that very thin layer of dermis responsible for producing the sole. If we can understand what the causes of that excess pressure are, I think we've got a long way towards understanding disease. And I think it's based on three pillars, or at least I'm currently grouping them into three pillars. They are environmental factors, the calving effect, and changes to the normal structure and function of aspects of hoof anatomy. And I'd like to run through them one by one. So firstly, environmental factors. It's not my intention to spend too long in this area, not because it's not important. I always get accused of underplaying the importance of environmental management as an aspect of lameness control. Clearly it's absolutely key and fundamental, and is the cornerstone of most of the lameness control plans that exist in our dairy systems around the world. But it's not where we've been doing most of our work, and so by rushing over it, I'm not trying to underestimate its importance. That certainly isn't my intention. So you'll know what all these are. So the first one I think we have to identify is concrete. I don't care what you say, nobody puts concrete in for cows' benefit. I think we need to fundamentally grasp that we put concrete in for our benefit. Concrete is not in for the cow's benefit. It is a truly terrible substrate from an animal perspective. Great to manage them on, but actually it's just rock hard. For me, the most entertaining example of this is when you go into milking parlours and with concrete floors, and the dairymen have put rubber matting in the milking parlour because they know standing on it for 2 to 3 hours is going to get uncomfortable, and so they've done something to try and to mitigate that pressure. It's just terrible stuff from an animal point of view, accepting that clearly we need it from a management point of view. But that's going to put a lot of excess pressure which the foot normally wouldn't be exposed to. And then of course we've got this whole area around standing and lying times. This would be the cornerstone of most lameness control plans, looking at time budgets and lying times and standing times, particularly in the bottom 25–50% of the herd, the cows which are getting out competed by the rest of the herd. So we could spend literally days talking about cubicle design, management, substrate, and all those other things that go along with it, and this aspirational idea of getting cows off their feet for all of the time that they're not eating, drinking, being milked, or socializing. And you know, this sort of idealized situation which you can find in well-designed systems. And then of course we've got the other big areas of environmental management, the trackways, particularly in the more pasture-based systems, and some of the walkways in concrete yards. And are they all UK? Yeah, they're probably all UK, but I could take you pictures like this from many parts of the world in the more extensive pasture-based systems at some times of year. But we have to accept, from a cow point of view, that makes things very difficult, because cows watch. They watch where they put their front feet. Their hind feet track up to where their front feet have just left. If you're walking through mud, you have no idea what you're standing on, and so of course we aim for these sorts of trackways which deliver a much better walking surface. Then we could go on to talk about all the other things we could do to try and mitigate pressure from the environment on on the claw capsule, like rubber matting at the two areas of high standing time, the collecting yard and the feed face, which can for many cows in some high yielding systems account for 6, 7, 8 hours of standing per day for the lower ranking cows. I also want to include at this point hoof overgrowth. It's not quite an environmental factor, but it sort of fits probably best in that category, because clearly if we've got hoof overgrowth and ledges of overgrown hoof applying inappropriate pressures to area of the foot, that is also going to cause us problems. But I think it's important to highlight, particularly with such a diverse audience that we've got both in the room and listening at home, that the relative importance and overall risk of different environmental factors will vary depending on the management system. It's not appropriate just to take management practices from a system and transfer them across, because what is important in some of the more extensive pasture-based systems is going to be completely different to the total confinement high yielding systems, and it's important we appreciate that the environmental risk factors will vary. So, as I say, not in any way wishing to gloss over its importance, but just to move on to other things. So the next thing I want to highlight is the calving effect. We've known about this effect for quite a while now, actually, and it hasn't really been particularly high on the lameness agenda. I've come right back round to it over the last 18 months because of some of the things that we've been finding in our work, and I think we are probably currently underestimating just how important it is. So the first thing I wanted to highlight at this point is just to remind you, what a phenomenal process parturition of a large singleton calf, baby, however you want to frame it, in mammals is. You know, in mammals which are giving birth to one large offspring, it is a truly remarkable biological process. It is also a truly remarkably destructive process. I've watched my wife go through this twice over the last 3 years, and it genuinely, it's when you start breaking it down to its biology, it's a truly destructive process, because to cut to the chase, this would not normally fit out of this. You know, there's a lot of biological change got to go on in order for that to happen. And fundamentally, what has to happen is we've got to see a lot of degradation of connective tissues within the reproductive tract. The reproductive tract has to basically degrade all its connective tissue attachments to allow passage of that large singleton offspring out through the birth canal, and that's why it's destructive. But the problem we have is we also know that what's leading to the degradation of the connective tissues in the reproductive tract have whole body effects. This is why some women end up hospitalized because of pelvic pain and pelvic instability close to giving birth, because that whole process degrades the connective tissue attachments to the point that the pelvis becomes unstable. And so what we now know happens is these very strong connective tissue attachments which anchor the distal phalanx to the hoof capsule also get degraded around parturition. And that's clearly got very important consequences for this very narrow layer of cells under the distal phalanx, because we can actually see that collagen attachment, that connective tissue attachment, running from the bone through into the hoof capsule. And a very nice piece of work done by the Bristol group 10, 15 years ago now demonstrated that around the time of calving, the force required to tear the hoof capsule off the underlying structures was reduced, i.e. there is more movement in the distal phalanx around the time of calving. So fundamentally, if we want to understand why we see most clawhorn disease 4, 6, 8, 10 weeks after calving, it's because the damage is being done, or some of the damage is likely to be done because of the increased movement of this pedal bone around calving, and it takes that time for the sole horn to grow out before we see the lesions at the sole. So the calving effect, as I say, I think we've probably underestimated its importance. I'm going to come back to it just at the end. And finally, changes to the normal structures within the hoof themselves. So I just want to spend the rest of the webinar just reviewing some of the recent work that we've been conducting in this area. It's not just us, it's going to build on some work originally conducted by the Zurich group, picked up by Cornell a few years ago, and then we've been one of the groups publishing a lot in this area over the last few years. So firstly, again, I want to remind you, particularly now, of two structures. Firstly, the digital cushion, which I'm going to talk about in a second, and secondly, the distal phalanx, this wedge-shaped bone. Those are two structures that we're going to be referring to. And just fix in your minds, if you can, what they look like in the normal claw. So this is a pretty normal claw that we've got in cross-section here, and just fix in your minds what those two structures look like. So the first thing I would like to talk about is the digital cushion. So originally described by the Zurich group, actually 15 years ago now, and it sat in the literature for nearly a decade before anybody else picked up on it. But they did some really lovely anatomy of describing these three pads of fat, soft fat, which lie underneath the bone in the hoof, in that narrow zone between the bone and the claw capsule, and they described it as looking a little bit like a training shoe setup. That sort of, it's a nice analogy, but it falls down in one respect, in that the job of the digital cushion, because it's fat, it's not really compressible. So its job isn't necessarily as a shock absorber. Its role is more in force dissipation. So as the load comes on the digital cushion, it dissipates the force onto the wall, the area of high tensile strength. The elastic tissues in the heel and the horn of the heel probably do a little bit of shock absorbing, but this is about force dissipation. And we've been putting feet through both MRI and CT scanners, and you can end up with these lovely images of these three parallel pads of fat which lie underneath the bone in the foot, and in that 3D reconstruction we saw at the start of the webinar. So 3 cylinders of fat, semi-liquidy type fat, fully forming second lactation. So not fully formed in heifers, fully forming in second lactation. This area got very interesting a few years ago when the Cornell group published the first work that demonstrated that the amount of fat, or the thickness of the digital cushion, was correlated to the fatness of the animal. So fat cows had thicker cushions, thin cows had thinner cushions, and that really set the cat amongst the pigeons in the sort of lameness world, because it really started answering asking some very interesting questions. And the Cornell group actually framed the first paper they published on this in this context. Wasn't quite the same wording, but it was the same meaning. Do lame cows become thin, or do thin cows become lame? Because we all know that thinness and lameness go together. So we all know that lame cows are highly likely to be thin. But this work asked an interesting question, which was, but actually, perhaps thinness leads to lameness, because if thinness leads to thinning of the digital cushion, that would interfere with the digital cushion's ability to dissipate force, and that could in itself put inappropriate force on the germinal epithelia, causing lameness. And so we ended up with this sort of vicious cycle for a number of years, where we knew that lameness had impacts on dry matter intake and nutrition, leading to loss of body condition score. So lameness and thinness went together. But we also know, particularly in the high yielding systems, that particularly the Holstein breed is losing a lot of condition to peak yield. So we have the possibility that loss of body condition to peak yield is leading to thinning of the digital cushion, interfering with its ability to function, leading to lameness. Then once lame cows stop eating, and they become even more thin. And so we were left with this very interesting cycle, and not really understanding where we were. And we've published quite a range of studies looking at this question over the last few years, and we've demonstrated in 3 separate studies using different cows that thinness precedes lameness, either identified by mobility score or by treatment for lameness. So we were really starting to tease out that actually loss of body condition may well be leading to lameness, accepting that that then makes the cows even thinner. We've then gone on, just last year we finished probably our most detailed study in this area, funded by AHDB Dairy. I want to highlight because they've really backed us on the lameness research over the last 5 years, and we've got another 5 years of funding moving forward. This is our most detailed study, and what we did here was we followed 185 cows in 2 herds longitudinally over time through lactation. So we examined them about 6 weeks before calving, just after calving, at about peak yield, and twice through the remainder of lactation. And we picked the feet up and we used ultrasound to measure this area here. So you can actually see this is the sole horn. So you can put an ultrasound scanner on the base of the foot and actually image through the foot. So here's the thickness of the sole horn, here's the bone at the top here, and this area here is the digital cushion and the chorion, this thin layer of cells responsible for producing the sole. I don't want to go into the detail of this study in a great amount of detail now, just because of time, but it really has informed where we are with this. Firstly, we can absolutely demonstrate that over time, that the thickness of the digital cushion, or the sole soft tissue thickness, as it's more accurately called, is linked to fatness of the animal. So we can track body condition score loss leading to thinning in this area, but it is incredibly small amounts. So 10 mils of back fat loss, that's equivalent to about 1 body condition score point, leads to thinning in this area of 0.1 of a mil. So we are talking about really fine margins. It's one of the reasons we've sort of gone off this as a real key underlying cause, accepting it's probably still right. But 2 other things we found which were really interesting. Firstly, this area here is thinnest around the time of calving. So calving is the time when this area here, measured by ultrasound, is thinnest. And we went, well, actually, that's not surprising, knowing what we know about the calving effect. The distal phalanx is likely to be sinking around calving, squashing this area, so we measure it thin. But the other thing we discovered was that when the animal had a lesion, this area was actually thicker. So if a lesion was present, the digital cushion and the chorion were thicker. I'm going to come back to that in a minute or 2. So that's the digital cushion story. We'll wrap it up in a second. The other thing we started doing was looking at the distal phalanx and changes to the bone. Something that a number of people around the world and groups have been looking at. A nice paper out of Japan a few years ago demonstrated that we saw changes to the bone in older cows. And if we put some of these feet through CT scanners, this is the sort of thing we find. So here's a normal bone. It's got basically a smooth surface. In some animals, after they've been culled, we find this mass of new bone growing off the base of the distal phalanx. This is a really extreme example. I've clearly picked one of the worst ones we've got, but you can see different severities. So completely normal, new bone starting to grow. The work we published last year demonstrated that the degree of new bone growth is linked to the amount, to the lameness history of the cow. So animals which have had more lameness during life have more new bone on the distal phalanx. Cows which have had little lameness history have no new bone, or less new bone, on the distal phalanx. And again, that starts there to raise some very interesting questions, because now I challenge you to fit this bone back into this picture and not put inappropriate force on this very thin layer of cells which are responsible for producing the sole horn. It's basically impossible. And the other thing, again, going all the way back to the Zurich group's work, what they demonstrated even 15 years ago, just using anatomy studies, was that in cows with sole ulcers, they saw scarring of the digital cushion, which again, if you consider all of that new bone, it's probably not very surprising that in these animals which we see with clawhorn lesions have damage to the digital cushion. And so we're really starting to put together now what is going on in the hoof. And I'm summarizing, and I sum this up by saying this is a horrible, self-perpetuating downward spiral of disease. Once an animal develops a clawhorn lesion, you start to see new bone growing on P3. That new bone probably leads to damage to the digital cushion, which in itself then impairs the ability of the foot to dissipate force, which in turn leads to another lesion, and so on and so forth. This is a vicious downward spiral of disease. I now think of the clawhorn lesion cow a little bit like the chronic high cell count cow. Once you start down this path, it is a very difficult train to get off. The high cell count escalator, the clawhorn disease escalator. You get on at the bottom, and it's very, very difficult not to just get shot off the top at some point in the future because of this perpetuating downward spiral of disease. And that would fit with a lot of what we see from the field. It would explain why disease is predominantly seen in older cows and animals which have had previous lameness events. Again, all our latest work is saying that the main risk factor for a clawhorn lesion is a previous case of a clawhorn lesion. It completely overwhelms all of the risk factors. Secondly, once disease becomes chronic, cows are more difficult to treat and less likely to recover, because once they've got that new bone and damage to the digital cushion, it doesn't matter what you do to treat them, all that damage is done. And thirdly, why it often takes time for the benefits of herd intervention programs to become apparent. Because if you intervene at a herd level with a really nice lameness control program today, all of the cows which are already on that escalator aren't going to benefit in any way, shape or form because you can't get them off that escalator. The only cows which will benefit are the heifers which carve into the herd after the change in management. So it's going to take 1, 2, 3 years before you see the benefits kicking through. And that's quite soul destroying when you're trying to manage disease on farm. And just to wrap up, I want to just highlight the role of information. This is an area we're really focusing on now. Three things are starting to suggest that inflammation is key here. Firstly, new bone is almost always the result of an inflammatory process. When we see new bone, it's almost always inflammatory. Secondly, it would explain why when these cows have lesions and we measure the digital cushion, the sole soft tissue thickness, it's thicker because it's swollen when they have a lesion. And thirdly, it would explain a treatment randomized controlled clinical trial we conducted a few years ago. Again, funded by AHDB Dairy. We conducted a high quality, we did it by the book randomized control trial, which are the gold standard for testing different treatments. I'm not going to go through the details, but we enrolled cows with clawhorn lesions. We randomly allocated them to receive either a trim only, a trim plus a block, a trim plus a 3-day course of non-steroidal anti-inflammatory drug, anti-inflammatory, analgesic, they go by a range of names, or a trim plus a block plus non-steroidal. And we looked at the proportion which were either sound or non-lame 5 weeks later. And we see the best recovery in the group that get a block and an anti-inflammatory as part of treatment. Again, suggesting that inflammation might well be key. And that's an area we're currently taking forward in the work that AHDB Dairy have funded with us over the next 5 years. So in summary, for me, excess pressure on the dermis is caused by a combination of environmental factors, the suspensory apparatus and the calving effect, and changes to the normal structure and function of the hoof as disease progresses. And so really in conclusion, I've got a number of take-home messages, and they are: firstly, managing the environment to reduce forces on the germinal epithelium in the dermis is clearly key. That's what most of the lameness control programs aim to do. But perhaps really importantly, early and effective treatment of clawhorn lesions appear to be vital in preventing recurrence. Because if we intervene when animals first have disease, we can try and pull them back off that escalator. If we leave them to this point, which I've talked this a number of parts around the world, and people smile wryly. I know it's not representative of what everybody does, but we definitely are in a situation where this sort of thing is one of the accepted norms for what treating a lame cow looks like and what it is. And again, I'm going to highlight, for me, that's not a lame cow, that's a cull cow. If we focus our effort here, we ain't going to get anywhere with lameness control. The animals we need to be focusing on are these cows, the point at which they become, the first time they become identifiably lame. Because if we can intervene at this point, we can prevent them getting on that escalator of progressive downward spiral. I particularly like this because this is also a first lactation cow, because it suggests that what we really need to target is control around those first lifetime cases of disease. So early and effective treatment. Inflammation appears to be central to disease, and therefore the likely role of anti-inflammatories, non-steroidals, analgesics, painkillers, whatever you would like to call them, is only likely to increase in the future. I think there's a real role in lameness control for this group of drugs. Managing body condition score loss to peak yield may well be important to some degree, but as it's a standard part of any herd management program, it probably makes sense. And finally, the calving effect may be more important than previously thought. I'm now increasingly convinced we need to target all of our lameness management around the fresh calved cow, particularly the fresh calved heifer. We expose them to this really destructive biological process, and at the same time we throw them into a herd of animals they don't know, who are bigger, stronger and more familiar with the environment than they are, and then expect them to spend hours and hours each day eating so that they can give the amount of milk we expect them to give, and learn how to lie down in what is very often a very new environment for them. And so I think there's some really important lessons that we can learn in that area. I'd like to highlight all of our funders, particularly highlighting AHDB Dairy. They've underpinned a lot of the work that we've been doing in this area over the last 5 years. It will, by 2021, be a 10-year program of lameness research they've funded with us. I work with a great big raft of collaborators and postgrad students. We've had some fantastic postgrads over the last few years, and as always, all I'm doing is taking the glory for a huge amount of hard work and effort that they've been doing within our group over the last few years.
I'd like to huge thank you to Jon for taking the time out of his busy day to come here and present. I would like to thank you all and bid you all good night.